Hello, today is the day 162 of 365 days project and I am here to say on neurogenic bladder. Let's see what is meant by neurogenic bladder. When neurological conditions affect the bladder, it is called neurogenic bladder. There are two major types of bladder control problems that are associated with neurogenic bladder. Depending on the nerves involved and the nature of the damage, the bladder gets become either overreactive or underreactive. What is the bladder? The bladder is a hollow organ located in the pelvis or the lower abdomen. The bladder has two important functions. One, it stores urine. Second one, removes urine from the body through a complex communication circuit in the spinal cord and brain. Urine incontinence occurs when a person cannot control the flow of urine. The storage of the urine can be a problem if the bladder is unable to empty fully or if it begins to empty itself before the person reaches the bathroom. If the sphincter controlling urination doesn't work or if the bladder spasms causes the bladder to shrink before the person reaches to the toilet. What causes the neurogenic bladder? Neurogenic bladder can be congenital birth defects that can cause neurogenic bladder, which includes spina bifida. This disorder may occur when the fetus spine does not completely develop during the first month of the pregnancy. Babies born with spina bifida often have paralysis or weakness that affects how the bladder works. Scaral agenesis. This is a condition in which parts of the lower spine are missing. Cerebral palsy. Cerebral palsy is a group of chronic, which is long-term disorder that weaken a person's ability to control body movement and posture. These disorders result from injury to the motor area of the brain. Cerebral palsy is not always found during a child's first year of the life. Various medical conditions are seen, which include stroke, Parkinson's disease, multiple sclerosis, spinal cord injuries, spinal surgeries, erectile dysfunction, trauma, accidents, central nervous system tumors, heavy metal poisoning. What are the symptoms of neurogenic bladder? The most common symptoms is being unable to control the urination, which includes a weak or dribbling urine stream, frequent urination, urgency, painful urination, which may mean there is a urinary tract infection. How neurogenic bladder can be diagnosed? A doctor will do an exam and may order several tests of the nervous system and the bladder to diagnose the neurogenic bladder, which include urodynamic studies. These bladder function tests measure how much urine the bladder can hold, the pressure within the bladder, how well urine flows, and how well the bladder empties when it is filled. Cytoscopy. The doctor may perform this procedure to examine the inside of the bladder and urethra with the use of a small telescope, which is known as cytoscope, X-rays, CT, MRI. How neurogenic bladder can be treated? The main treatment for neurogenic bladder are clean intermittent catheterization, CIC. Catheters are thin, flexible tubes that can be inserted through the urethra and into the bladder to drain the urine. Drugs. Medications are prescribed to improve your bladder function. Specific medications for neurogenic bladder depend on if your bladder is overreactive or underreactive. Injections of botulinum A toxin. A doctor injects Botox into the bladder or urinary sphincters. Bladder augmentation. This is a surgery in which the segments of the intestine are removed and attached to the wall of the bladder, which is coincidentally known as sigmoid colon. This reduces the bladder's ability which have internal pressure and increases its ability to store the urine. Lifestyle changes. These may include avoiding certain foods or drinks that can irritate the bladder. Ileal choledoct. Part of a small bowel is used to make a urine stoma. This stoma drains the bag attached to the outside of the body. These are the several types of treatment for neurogenic bladder. Thank you.